As you know, just under 3 weeks ago, I declared an end to COVID-19 as a public health emergency of international concern. It was a moment of relief and reflection. It's encouraging to see life return to normal, to be able to hug a friend, to travel freely, and to meet together. The pandemic has confronted us with unprecedented challenges, and it has also demonstrated what your WHO is capable of, what our WHO is capable of. Throughout the pandemic, your WHO has mobilized global expertise to provide technical and logistical tools to support you in your efforts to save lives. Through the ACT Accelerator, WHO and our partners delivered nearly 2 billion doses of COVID-19 vaccine, as well as tests, therapeutics, oxygen, PPE, and other medical supplies. The end of COVID-19 as a global health emergency is not the end of COVID as a global health threat. In a world of overlapping and converging crises, an effective architecture for health emergency preparedness and response must address emergencies of all kinds. This year's high-level meeting on pandemic preparedness and response is a valuable opportunity for leaders to chart a clear path forward towards that future. We cannot kick this can down the road. Strong primary health care is especially vital for delivering life-saving services, maternal and child health, including routine immunization. Between 2019 and 2021, an estimated 67 million children missed out on at least one essential vaccine, including 48 million children who missed out entirely. In response, WHO and our partners have launched the Big Catch-Up, a global effort to increase vaccination levels in children to at least pre-pandemic levels by the end of this year, and to protect those who missed out. In 2022, 48% of children below 6 months were exclusively breastfed, getting close to the target of 50% set by the World Health Assembly. And we continue to support research to improve care for pregnant women. Last year, WHO reviewed evidence from trials in 20 countries that showed for the first time that immediate skin-to-skin care or kangaroo mother care can save almost 1/3 of children born preterm. And following WHO's recommendation for widespread use of the RTS malaria vaccine in 2021, more than 1.5 million children have now received it in Ghana, Kenya, and Malawi. Among those vaccinated, we see a 30% reduction in severe malaria and a 10% drop in child death. We estimate that one death is prevented for every 200 children vaccinated. Put simply, the vaccine is changing the course of malaria. Vaccines have extinguished smallpox, pushed polio to near eradication, and tamed multiple other diseases. And vaccines are bringing the dream of eliminating cervical cancer within reach. Since WHO's call to action to eliminate cervical cancer in 2018, nearly 50 more countries introduced the HPV vaccine into their national immunization program, including 41 lower middle-income countries. In addition to COVID-19 and Mpox, last year WHO responded to 70 graded health emergencies, from floods in Pakistan to Ebola in Uganda, the war in Ukraine, cholera outbreaks in more than 30 countries, and complex emergencies in the Greater Horn of Africa, northern Ethiopia, and the Sahel. A crucial enabler of our response was the Contingency Fund for Emergencies, which was established following the West African Ebola outbreak in 2014 and 2015. Last year, the CFE released almost $90 million in as little as 24 hours to support the rapid response to emergencies. Already this year, we have allocated more than $37 million to fund our response to the earthquake in the Syrian Arab Republic and Turkey, the conflict in Sudan, and more. The end of COVID-19 and Mpox as public health emergencies of international concern means polio remains the only official global health emergency. After an all-time low of 5 wild poliovirus cases in 2021, we saw an increase last year with 20 cases in Pakistan, 2 in Afghanistan, and 8 in Mozambique. So for this year, there have been 3 reported cases of wild polio virus, including 1 from Pakistan and 2 from Afghanistan just last week. WHO and our partners remain steadfastly committed to finishing the job of consigning polio to history. Last year, 3 million children previously inaccessible in Afghanistan received polio vaccines for the first time. The mRNA hub in South Africa is a perfect example as part of our commitment to strengthen local production and enhance pandemic preparedness and response globally. The hub has now started transferring technology to manufacturers in 15 countries, supported by the Biomanufacturing Training Hub in the Republic of Korea, which has trained 300 staff in low and middle-income countries. The mRNA technology transfer program holds huge promise, not just for vaccines against COVID-19, but also for other diseases, including HIV, tuberculosis, malaria, and more. In so many ways and in so many places, your WHO is working to promote, provide, protect, power, and perform for health, the 5 Ps. As we celebrate WHO's 75th anniversary, let us commit to do even more together to promote health, keep the world safe, and serve the vulnerable.